Well, good morning, and thank you for taking some time to join us for this webinar. This webinar is being presented by the California Department of Education for Early Learning and Care Contractors. It's being jointly presented by the CDE's Early Learning and Care Division and Fiscal and Administrative Services Division. This webinar is being held today, August 14th, 2020, and we're scheduled to run from 10 a.m. until 11 a.m. And can we advance to the next slide, please? Thank you. My name is Stephen Profiter, and I'm the Director of the Early Learning and Care Division at the California Department of Education. Even after more than 5 months into it, the pandemic continues to present challenges for all of us. The CDE is committed to continue to persist to best support children, families, providers, and contractors. We continue to work with other state agencies and local partners on solutions to the truly complex issues this pandemic presents. We thank you for everything you are doing to support children and families during this crisis. The team presenting this webinar and the rest of the teams in ELCD and CDNFS working behind the scenes have gone above and beyond since the pandemic hit, working through weekends and late into nights to support local programs and implement the policies the legislature and administration have agreed to. As we work on guidance, we really wanted to make sure that we are clearly communicating with all of you to let you know where we are in the process and answer your questions in a dynamic and engaging format. This webinar will be the first of a series aimed at getting you the most updated information, letting you know what we're working on and what's upcoming, and answering your questions. And with that, I'll turn it over to the ELCD's Associate Director, Erica Otiono, for some additional remarks.
Good morning, everyone. That's great. So I just want to welcome you all. This is Erica Otiono, the Associate Director of the Early Learning and Care Division, hoping to provide you as much information as we have up to date, and also to have this opportunity to say thank you to all you do for children and families. So thank you. You'll hear from us soon. And thank you, Stephen, for introducing me.
And I also wanted to introduce myself. So my name is Virginia Castor Early, and I'm the administrator of our policy office here in the Early Learning and Care Division. Thanks so much. Again, just want to echo Steve and Erica's thanks, and also thanks to all of your engagement in the policy process. We definitely can't do what we do without you. So just as context, my office is lead over issuing all the guidance and also working with the legislature and the administration to ensure that priorities and needs from the field are being addressed and also being elevated. So I think now we'll turn it over to Alana, who's going to do some housekeeping things, and she's going to be the moderator of our Q&A section.
Good morning. As Virginia said, I'm Alana Andrade, and I'm the Child Development Consultant in the Policy Office here at ELCD, and I'll be moderating this webinar. So I'll just be helping to make sure that some questions get answered, and our panelists are being able to understand what's happening in our Q&A box. So thank you for those who have already started to use that. Please use the Q&A or the question and answer box to put in your questions instead of the chat. I think the chat will be more for the pleasantries that you've already started, like good mornings. And we have a full team here helping us to answer some questions in the chat box. A very dynamic crew working across a few divisions and offices. So today we've got Cassandra Lewis, Richard Miller, Daniela Cisneros, Corey Kahn, and Andrea Johnson. And I know we're all getting very used to using Zoom, but I will also just speak again that we ask that you mute yourself and your microphone so we don't get any background noises. And then again, to please direct all the questions into the question and answer feature. And if while we're working through the presentation, we don't get all the questions answered or your question was not answered, you can always submit your question to the ELCD emergency inbox, and that email address is elcdemergency at cde.ca.gov. Okay, I'm going to turn it back over to our panelists.
Awesome. Thanks, Alana. So here's a brief overview of our meeting agenda, what we're hoping to accomplish with you all today. So as by way of our introduction and overview of our work, as Stephen mentioned, our staff have been working really around the clock with both the legislature and the administration to both influence the decisions that were made in the state budget and provide them with technical assistance as they've crafted the budget, and work to really elevate the issues from the field that have emerged since the budget was signed at the end of June. We are in a position at CDE where we have to implement what is in state law, and we unfortunately don't have the ability to appropriate our own money. And so we're really dependent on the money that the legislature and the governor's administration give us through the budget process. And so we're working closely with them through those processes, but at the end of the day, we're in a position where we work to implement those agreements. At the same time, as we've worked on all those items, we've been putting out management bulletins. So today we want to update you on all this work that we've been doing, starting with our recently released guidance through Management Bulletin 2014, Management Bulletin 2015, but also talking you through some of the email directives that we've sent out on our listserv. As I mentioned, we've been working closely with the legislature and the administration since the budget was signed in June. And the legislature is now in the process of revising various pieces of the June budget language in an August process. And we've been working really closely to inform that revision. So we'll talk a little bit more later about what those pieces are. But in areas, the top line here is that in areas where there is an agreement, but not maybe a bill that's changing something yet, we're working, but there's a commitment from the legislature and the administration to act on something this month. We know that everything is very urgent from the field's perspective, so we've been releasing email directives using some short-term authority that the superintendent has to issue such directives until the legislature and the administration can come behind by the end of August and sort of extend those pieces. And we're only doing that in cases where the agreement is very solid. So we can talk more about that later when we get to the email directives, but that's the purpose of us releasing those email directives. Also on this webinar, we'll be providing an update on state and federal monitoring and some additional information on forthcoming allocations. We also want to give more clarity on some of the ongoing CDE guidance we're working on and what's ahead, and then of course take your questions. And so as Alana mentioned, we have a team of folks that she mentioned working behind the scenes through the Q&A feature. We're also going to start the Q&A period going over some pieces that were submitted to ELCD Emergency to launch our discussion. I think that's it for this meeting agenda, so we can move to the next slide. So Management Bulletin 2014, we released this last month, July 13th, and it really, it replaces Management Bulletin 2006A, and it gives guidance to state subsidized early learning and care programs on, provides guidance on the topics that are mentioned on the slide. So first of all, what the continuation of emergency childcare for children in the California Alternative Payment Program, or CAP, and the California Migrant Alternative Payment Program, or CMAP. And specifically, the June budget allocated money to extend the amount of time these children could be served for up to an additional 90 days or until funds are exhausted. And then if a contractor expects that they'll be able to go beyond 90 days with those funds, the contractor can extend those. So it gives guidance on those pieces. In terms of transition of emergency child care families into ongoing care and the priorities for their enrollment, I won't go into all the details of this guidance because it's pretty, we hope at least that it's clearly laid out in our management bulletin. But what it does is it charges our contractors to transition families who are enrolled in emergency childcare before June 30th to transition those families who are eligible for ongoing services into ongoing services that they're eligible for. And it lays out 3 separate sets of priorities for transitioning those children into ongoing care based on what contract is enrolling them. So there's one set of rules for families transitioning into ongoing care in our CAP programs, another for CMAP and CMIG, and another for our CFPP, CCTR, and CFCC contracts. If you have any questions more detailed about this management bulletin and these priorities, feel free to put them in the chat box. We're happy to address them. We want to make sure that this conversation is as responsive as possible to your questions. So we'll just hit the high notes, and then where you want to go detailed, we'll try to do that more in our question and answer period. As a reminder, this management bulletin also has a hold harmless for emergency childcare determinations, which means that contractors are not held responsible for verifying if a parent or guardian's work is essential. It's a self-certification on the behalf of the parent or guardian. I'll let Corey go into more detail about alternative payment contractor augmentations, but really quickly on the family fee collection piece, this is a component of Management Bulletin 2014. It has a section around charging family fees. I want to be very clear here that since the posting of this management bulletin, we'll talk about it in another slide or two, we've released an email blast with guidance that family fees have been waived for the months of July and August. So we're working on updating this management bulletin to clarify this information. But for now, please rely on the email blast we sent out on family fees where, if it conflicts with this management bulletin. So I will turn it over to Corey now for some updates on the fiscal pieces of this.
Hi, good morning. My name is Corey Kahn. I am the manager within the Child Development and Nutrition Fiscal Services Unit within Fiscal and Administrative Services Division. I am first going to chime in just to talk about the allocations that we provided or will be providing to contractors in regards to emergency childcare. So the 2020 Budget Act appropriated $73 million to extend childcare services for those enrolled in alternative payment emergency childcare. So when this first we received in 1920, $50 million for the purpose of enrolling children into emergency childcare. And that was originally set to expire June 30th. So this is now extending anyone who was enrolled by that time, extending the care. We also received an additional $47 million in the 2020 Budget Act to transition those families that received the temporary vouchers for emergency childcare in 1920 into ongoing care. So I'm going to talk about a little bit how we distributed and determined the allocations. So to distribute these funds, the CDE released the Alternative Payment Emergency Childcare Survey. That was released to contractors on July 10th, 2020. And it was to all CAP, so California Alternative Payment Program contractors, and CMAP, which was the California Migrant Alternative Payment Program. And it was really released to the contractors for the purpose of determining and obtaining the necessary data that we needed to allocate these additional funds for the emergency childcare purpose. The methodology first to distribute the $73 million, which was extending care. So the intent of that was to provide an equitable amount of time to extend care for all emergency childcare enrollments. So with this intent, we estimated that each child's care can be extended by approximately 5 months or for a longer period of time if a contractor's fiscal year 2019-20 balance allowed them to extend it longer. And then for the $47 million that we received to transition those in emergency childcare into ongoing care, contractors received a proportionate share of the total funds available if they stated in the survey that they were serving children in emergency childcare. So the statewide data, once we did that, it provided approximately 25% of emergency childcare enrollments that could be transferred into ongoing care. So once we completed these, we completed them actually at the end of July, and all CAP/CMAP contractors received an email from their fiscal analyst informing them of the additional funds that they would be receiving for this purpose or these two purposes. The email provided verification that the Budget Act amendment that you would be receiving around September would include the amount specified for each purpose. It pretty much notified contractors that it would be included in one Budget Act amendment that would be released in September, but we wanted you all to know how much you would be receiving for extending the care and then also trying to transition them into ongoing care. So with that, I will turn it back over to Virginia.
Thanks, Corey. So just our next, one of the other recent management bulletins we've released is Management Bulletin, or MB in the vernacular, 2015, which covers alternative payment provider reimbursement and data collection. So this management bulletin provides guidance on the following guidance that's as it's specified on the slide. We posted this on August 3rd, and it gives guidance on AP provider reimbursement, provider notices, and the new data collection. So by way of context, the Budget Act allocated $62.5 million to support CAP, the California Alternative Payment Program, and the CalWORks to reimburse providers through June 30th of next year or until funding is exhausted, whichever is sooner. And this really supports, the money is going to be distributed through contract amendments in September. Contractors must use the funds to provide reimbursement to open AP providers, including license exempt providers, and basing that on certified need. And this is certified need regardless of attendance. The Budget Act also stated that beginning on July 1st, AP contractors must provide written notification to providers when there are changes to a family services. So they have to provide the notice of action to the provider at the same day it's given to the family. And then on data collection, beginning July 1st, all of our CAP and CMAP contractors, they're going to be collection requirements for these non-CalWORks AP programs, similar to what has been collected in the CalWORks programs. And I know that our Child Development Nutrition Fiscal Services Unit hosted a webinar this week on this topic. And so Corey, can you speak to that a bit more?
Yeah, so yesterday, it was actually yesterday, we hosted a webinar to discuss the changes in reporting requirements affecting CAP and CMAP contractors. So as Virginia stated, effective July 1st, all CAP and CMAP contractors are now required to report monthly caseload and fiscal data to CDNFS, so to our office. In SB 98, it states that the following data elements are to be reported beginning July 2020. So I'll just state the list of data elements. So it's county by county caseload, expenditures, unit costs, family fees, and other key cost of care variables requested by CDE, which we're going to use to determine allocations. That we'll talk about a little bit more in the next few slides. So how we did this is we really mirrored some of the questions that some of our stage 2 and stage 3 contractors already respond to. We're now extending that to CAP and CMAP. So monthly caseload and fiscal reports for AP contracts will now be submitted monthly and electronically. So all of these contractors already have an existing login to submit on our website. They've been doing fiscal reports either monthly or quarterly, and you will continue to use that login to access the caseload report. And so there are questions about just normal enrollments, and then also those children that are enrolled in emergency childcare. And so those are the two distinctions that have been added to the caseload report. And so we communicated yesterday that the revised caseload report will be available on Monday, August 17th, so that you can meet the July 2020 deadline, because it's always due 20 days after the reporting period ends, so that would be August 20th. In the meantime, we did get questions yesterday about having the information or the data elements provided ahead of time. So our fiscal analyst will be contacting, if you haven't received it already, they will be sending out the questions via email to their fiscal contacts no later than today. So you should be receiving that. And so I just want to state that because the CDE will be using caseload and expenditure data reported by CAP and CMAP contractors for the additional state allocations that we'll go over in the next few slides. We want to say it's very important that you report timely and accurately on this July report. So another question that we got yesterday was regarding the need to update software that contractors use to report caseload and expenditure data. And so this software is something like, I think an example was NoHo that was brought up yesterday. So we understand that it does take some time to update that software. It's an outside vendor, but we do want to reiterate that we are required to collect this data as of fiscal year 2021 from the CMAP and CAPP contractors. And that, again, we'll be using that data to determine some future allocations. So if you're unable to update your software in the time for July reporting, please begin working on means for reporting July data to us timely. If you need assistance with reporting, you can reach out to your fiscal analyst just to talk over some of the data elements if you need to. And then Virginia, I think I'll turn it back over to you.
Oh, Eric, sorry. Can you go to the next slide? I was on mute on my phone. Thanks, Eric. So, and thank you, Corey. So as I mentioned when we were going through the agenda, there are various, there are various email directives that we're working on where we want to get out guidance as soon as possible, and we are still working sort of through some other issues on the back end, but we don't want to hold up what we are able to provide guidance on. And so for the first, so we've sent, you can see here in terms of recent email directives, there are 4 that we really wanted to highlight for you, and we flagged the dates that they were sent out on our listserv or posted to our listserv for each of them. So the reopening, we sent out an email on reopening for direct contract programs, which was posted to our listserv on July 19th. Many of you, I know from the chat, are asking about distance learning and pieces around how does the hold harmless work. So I'll hit some high points from this listserv, and then we can address more in the Q&A section. Basically, the state's June budget requires programs that are operated by, requires programs that are operating by a direct contract program like CSPP or CCTR to open by September 8th or within 21 calendar days from the start date of their program calendar, whichever is sooner. So based on the budget, programs can only be funded to be physically closed if they're closed due to a state or local public health order. If you want to get super nerdy and look at where this is in state law, you can look at, I think it's Education Code 8209F. So you can see kind of what's been laid out for us to implement there. Now, this is something we know that things have evolved since the time that the June budget was passed. And as I mentioned, we're working with the legislature on sort of going through and thinking through a couple of things that weren't sort of elevated at the time that the June budget passed. So we put out an email blast clarifying some pieces. And this basically says that we're going to be releasing an upcoming management bulletin and that it'll cover a lot of the issues that folks are raising to us. But it also gives guidance until the management bulletin is released that direct contract programs that are either operated by an LEA or are on an LEA campus, so that they're on this LEA campus, whether they're operated by the LEA or a community-based organization. They may physically close and continue to be funded when the LEA has determined that it may not open. So other programs that aren't operating on an LEA campus have to remain open unless, in order to be fully fiscally held harmless and reimbursed, unless those programs have been directed to close by a local or state public health department. So, however, the email blast also says, let's say the program start date was August 1st or something on the program calendar, which would mean that based on this, the program would have to open by August 21st. We also say in this email blast that any contractor can revise their program calendar due to situations where they're not going to be able to open within 21 days. However, the programs at this point have to open by September 8th because that's the backstop. And we'll give more guidance when we come out with the piece around that. And I'll talk more on a later slide about our next steps on that specific area. This listserv also shares that once the LEA once the LEA isn't requiring the closure anymore, or the state or local public health agency decides the campuses are safe to reopen, then the programs on LEA campuses must physically reopen as well. I already mentioned our email directive related to guidance on family fees, which was posted to the listserv on July 28th, 2020 of this year. Basically, as I mentioned, it gives guidance to contractors to suspend collecting family fees for July and August, and to notify families that those fees have been waived. And it directs contractors not to disenroll families for non-payment of family fees until we release further guidance. The third item we've had a listserv on, and this is just running through them, is guidance for serving school-age children during distance learning. So this notifies providers that there's a regulation that everyone was asking us. It specifically applies to providers that get the regional market rate. So California Alternative Payment Program, CalWORKS, for example, that says that providers cannot be reimbursed during scheduled instructional minutes. And so this listserv clarifies that CDE does not consider K-12 distance learning to be scheduled instructional minutes for the purposes of reimbursing providers. And so providers should be reimbursed for care during the time school-age child is participating in K-12 distance learning. And then the last item here is guidance we released it also on August 7th through an email on parent signatures for monthly attendance. And that, as I said, was posted to our listserv on August 7th of this year. So this directs contractors not to withhold reimbursement to providers on the basis of attendance records and or invoices not having a parent signature if the provider is attempting to collect a signature and the parent or guardian is unable to sign due to the COVID-19 pandemic. And providers, have to continue to support to submit the attendance records. But if they, if they're able to share that they weren't able to hear back from the parent and get the parent to assign due to COVID, that the provider can still be reimbursed. So I think we'll sort of pause on. We'll sort of turn it over to Erica for some the next piece, and then we'll come back after Erica and Corey have said a piece to talk through what our next steps on issuing guidance are.
Next slide. Good morning, everyone. Glad to see all your names on here. So this is, you've been hearing about policies and guidance. So I just want to give you a quick update on the program aspect, the implementation and program aspect of your contract. And on the slide, there are 3 main bullets. The first bullet has to do with training and technical assistance. The second bullet has to do with monitoring. And the last bullet has to do with results of the 2020 Improper Payment Elimination Recovery Improvement Act. We call it IPARIA. So I will go one by one just to give you a quick update. Program Implementation Office, we meet every year. We look at what we did last year and where we're going moving forward. So for this fiscal year, with the pandemic and all the issues we have, we decided to just focus on what is needed for this fiscal year. So for training and technical assistance, we just have like 3 key main topics that we're going to focus on. One is going to be certification of families, because definitely we're going to certify families. So we'll look at that piece. And I know that many of you are doing great work already. So we are also going to be reaching out to you for some of the ways that you're already doing remote certification for your families. So we're also going to do another training on remote monitoring. What does it look like? What are you supposed to do? So that's one other topic. And the last topic we want to focus on is working with children and families in times of COVID pandemic. For that last topic is just one topic, but we're going to have a series of webinars on it. Part of that series of webinars, the main one will be for those of you that have center-based contracts or direct service contracts at family childcare home and centers. We are going to be providing clarification on the use of the Desired Result Developmental Profile, DRDP. So we're working right now collaboratively with West Ed to come up with guidance on the DRDP. Guidance, not just guidance on what you have to do, but guidance in terms of resources of how to do it. We know for the DRDP, we have the comprehensive, the fundamental, and essential. So we're looking more at the essential, which has 25 elements. We're looking to reduce that to 15 or 16 maximum, and to provide resources for both parents and for teachers and for providers. So coming soon. I know DRDP is a challenge to complete, but with DRDP, this is a time that we have to do DRDP. We have to look at children's socio-emotional development. We have to support families. We have to provide children's growth and development, especially at this time. We know the consequences of stress on young children. So being able to observe in early childhood, we don't have pen and pencil, that we have kids do an exam to find out how well they're doing. What we do in early childhood is what I call the power of observation. So right now, we need to strengthen our observation skills so we're able to document what we see and be able to use that information to support children more so during this time. We don't want any damage on children's growing brains at this time based on the stress that is going on. It's not just for adults, it goes to the children too. So it is so important, so important. But again, we're going to provide the field with key resources, training, hands-on, quick resources to do the DRDP. So coming soon for the DRDP. The next one I want to talk about is monitoring. Monitoring for this fiscal year will be mainly by remote. It will be remote monitoring. For sure, we're not traveling through the end of 2020. Come January, we'll reassess and see where we are, but for right now, it will mostly be by remote. Those of you that are school districts, you already know about remote monitoring. We call that online federal program monitoring. So for FPMs will start next month. It will start next month. We already did a training for these contract monitoring reviews. We're hoping to start maybe in October. You will get a letter if you're going to be monitored. You will get we'll have focused training for those that will be monitored. We'll work jointly. Monitoring is not a gotcha. It is a process for continuous self-improvement. So we're working together. There are 20 items on the review items. Some of them require observation. So we're looking at tweaking the system to make sure that we meet the needs of everybody for those ones. I know, for example, the environment rating scale, we're not going to observe that. So we may be looking at reciprocity. We may be looking at the last one that you did prior before the pandemic hit. So we have different ways that we do that. Another one is ratios. We're not going to be there to look at your ratios. We may have you do self-certification for your ratios. So again, it's about working together. It's not they and us. It's not the CDE and the field. It's about working together for children. So stay tuned for the monitoring. Essentially, we're prioritizing those agencies that were scheduled for reviews last year that we didn't review. So those are key, first priority. The last thing I want to talk to you about is the IPARIA that I mentioned originally. If you did participate, just show a hand, or on the chat, you could just say yes, yes, yes. If we selected one file from your agency, let me give you 1 minute. Just put on the chat, yes, 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 yeah. So as you're doing that, the IPARIA, this is a requirement by the CCBG that we have to do every 3 years and give them a report. And I'm glad to tell you that this year, our error rate is 3.12, which is a reduction from the last 3-year cycle, which was 4.46. So we're doing well, but as a state, we want to do better. So what we're doing with the IPARIA is we're going to develop a webinar, just not a training webinar, but just a webinar to inform the field of the outcomes from the webinar. How many files, the authority, the results, and all the key areas. But essentially, 2 key areas are one of the reasons for the 3.12 error rate. One has to do with alternative payment programs. The other one has to do with center-based programs. For the APs, it has more to do with choosing the provider rate. So instead of choosing the lower, some contractors were choosing the regional market rate ceiling, which is higher than there. So coming soon, we'll reach out to those agencies to provide training and technical assistance. And for the center base, it was more the seeking employment. Seeking employment has some limitations, but many times agencies provided full-time care for seeking employment. So coming soon, we'll provide the results of that to you and be able to provide training and technical assistance. So before I end, I just want to summarize that giving you quick update on training and technical assistance, monitoring, and of course the last federal review that we have just had. So I just want to thank you all for good work that you're doing. Stay tuned. We'll work together. We'll be reaching out for some of you. I know you have some questions about distance learning coming soon about distance learning. I've reached out to many agencies statewide to look at distance learning for children. If you remember, the use of technology for children is so limited. So I have information out to the American Pediatric Academy to find out what they think. I have information out to University of North Carolina to see what they think. So, and I have given a lot of people homework to think about distance learning for children. So we're working on that, so coming soon again. If you have any ideas also, send them our way. Thank you so much, and I hope I didn't use lots of your time. So over to you.
Eric, can you go to the next slide?
Okay, so this is Corey again. I'm here to talk about the forthcoming allocations really briefly. So the 2020 Budget Act provided additional funding, more than what we talked about in the last couple slides. So the CDE still has $62.5 million to reimburse providers based on the maximum authorized hours of care for children enrolled in stage 2, which is C2 AP, stage 3, C3 AP, CAP, and CMAP. Additionally, we have $62.5 million to provide providers with a one-time stipend for providers who contract with a stage 1, stage 2, C2 AP, C3 AP, CAP, or CMAP agency. So with those two, the CDE is currently working with the legislature, administration, and the Department of Social Services on how to allocate these funds. And the CDE will be releasing additional information as soon as we have them available. And then the last bullet on this slide is $50 million to support expansion of the CCTR program. So the 2020 Budget Act also maintained $50 million to support the expansion of CCTR, which was initially funded in 2019 Budget Act. The CCTR expansion is now funded by Prop 64 and requires a transfer between or from the Department of Healthcare Services, DHCS, to us, the CDE. So contractors who were awarded the CCTR expansion funds received their award letter. However, the CDE cannot release the funding to contractors until CDE receives the funding from DHCS. So we are in frequent conversation and communication with DHCS, and we're hopeful that we'll have an agreement executed very soon. And so once that happens, we'll be in contact with all of the awardees and we'll notify you as soon as the contract is executed. So that's all I had to provide in that update.
Okay, so, and I will try to go really quick through the next slide because we have so many questions that we want to get through, and we're coming up on the hour. So really quickly on this slide regarding our ongoing CDE guidance work, you can see that we've listed a couple topics here. First, in terms of guidance on procurement, we will be sending out an email blast shortly with additional guidance on this, which will include a date and a time for an upcoming webinar at the end of August, specific to the procurement issues. With regards to family fees, we know that there are a lot of questions about family fees in the chat, and we'll address those when we pivot over to questions, hopefully in another minute. But we will be doing a management bulletin related to family fees. And we're working tirelessly on that. The team is working right now on drafting that. Just one thing to keep in mind, is that this is an unprecedented amount of guidance for us to be issuing, so we're working as fast as we can with long hours. But you know, we want to make sure that we get it right so that we don't release it and all of you say, this doesn't make any sense. In terms of the third bullet here, reimbursement for and distance learning requirements for direct service contractors, we know that this is something that everybody is really looking for. Erica alluded to it a little bit in her remarks. This is something that we're working on. This is also something that we're still having to work through with the legislature a little bit on a certain piece of it. And so our current plan is to release another listserv, further clarifying what we are able to clarify at this moment, and then having a management bulletin ready to go. So as soon as any changes are made to the state law, that hopefully as soon as it's signed by the governor, we're ready to post the management bulletin, you know, hopefully like within several hours. So that's our current goal at the moment for that. So another listserv announcement and a forthcoming management bulletin. In terms of our COVID-19 guidance to the California Resources and Referral Programs and our local planning councils, we're partnering with Department of Social Services on this to get this across the finish line. Finally, we're going to be re-releasing Management Bulletin 2015 that will clarify, there'll be a 2015A, which will sort of put the pieces around parent signatures and the pieces around the sort of school age attendance during instructional minutes questions, and then we'll just incorporate it so that you don't have to be cross-referencing between a listserv that contradicts things in the management bulletin. So at this point, let's turn it over to questions. We've got 10 minutes. I think our hope is that in giving you a broad overview of a lot of these pieces that we're working on, we've hopefully answered a lot of the questions. We tried to tee this presentation so that it was addressing things that came in through our ELCD emergency inbox, but we know that we can't get to everything, and we want to also be responsive to your live questions. So Alana, can you, turning it back over to you.
Hello, everyone. Thank you for your participation in the question and answer. The team and I have been trying to work hard to answer as many as possible. So as Virginia alluded to, there have been a lot of questions about family fees, especially about family fees resuming on September 1st. So if we can answer a little bit more about that.
You might be muted, Virginia.
Oh, can you hear me now? Okay, I just said I was happy to take that question. That's all I had said. So family fees, as we mentioned, are suspended for the months of July and August. So I won't repeat what we already said about that. As I mentioned, we will be releasing further guidance around, you know, folks are asking questions around reimburse, you know, how do we reimburse families, you know, and we know that some APs have already, you know, some contractors have already reimbursed families, so we'll want to be sure to engage with our stakeholders to make sure that whatever guidance we release isn't contradictory and doesn't create any issues there. But I can say that we are working with the legislature and the governor's administration to waive family fees for distance learning and family sheltering in place starting September 1. So starting in September, under this pending agreement, family fees would be waived for just in the cases of where there's distance learning happening or the family is sheltering in place. Now, that's not in law yet, so we can't implement it yet, but that's our understanding of the agreement that has been made between the legislature and the administration, that will be addressed. So CD is in kind of a sticky spot right now where we understand the agreement, but we don't want to tell you to implement an agreement until it's officially in law, because that can put all of you in a difficult spot. So we want to be transparent with you about where the process is. CDE, we have to work with our state partners, just like you have to work with your local partners. So that's where we are on family fees. Alana, are there any nuances of family fees that are coming up in the chat that we should make sure that we're addressing?
A lot of the nuances were about how to reimburse and if they're considered credit. So a few of the questions, which were very similar, were about, if we are reimbursing for July and August, would we just consider it a credit in the next few months?
Yeah, so we'll be addressing that in the guidance, but based on our conversations and the agreement we've made with the governor's office and with the legislature, that they can be either a credit or a reimbursement. If your family is an emergency childcare and they stop receiving services, a credit for a future month doesn't really help them. So more to come on that. What's our next question?
So there's a lot of questions about distance learning. One of the ones I pulled is, so we're a joint unified school district program. Our classroom is closed, but we are providing distance learning. We are currently using the strategies described in the COVID-19 program quality plan that was submitted to ELCD in April 2020. However, kindergarten has a different set of requirements. So is there guidance on distance learning requirements for ELC programs?
So as I think Erica mentioned, we're working on guidance around specifying our requirements for distance learning. Until we release that, continue to use your contractor's COVID-19 program quality plan to engage children and families. And then once the management bulletin is released, you can make the necessary program adjustments.
And there are also lots of questions about how to document attendance for distance learning.
Corey or Andrea, is that something you want to answer?
So we are actually having a meeting, I believe, today about that. So we can flush out the details between what is required programmatically and then how that will relate to reporting on our report forms.
Okay.
So
well,
more to come.
Yes, we appreciate and hear you when a lot of the questions and answers have been, we don't know what soon means. Does that mean tomorrow? Does that mean next week? And as everyone here, all the panelists have alluded to, that we really are working hard to make sure that we get you the proper guidance. And since Corey, you had just answered, I'm gonna ask you to answer this one as well. So it's about contract earnings due to, including when there's low enrollment, because there's lots of social distancing guidelines. So we are open and providing services, but attendance is down significantly. Will you clarify how we are going to earn our contracts?
So we understand that that will be obviously the reality for programs that are open. Attendance will probably be lower than normal. And what Virginia had gone over was how the, for fiscal year 2021, the reimbursement calculation will be based on the lesser of net reimbursable program costs and your contract maximum reimbursable amount. So essentially that is kind of not even looking at your enrollment and attendance percentage because we know that might not be at the normal levels as what they would be. So that is for programs that are open. So.
Okay, there are also a lot of questions about the DRDP, especially if there's going to be continued distance learning. Are we required to complete the DRDP, and also how are we required to complete the DRDP, especially when the children are not in front of us? So how do we complete them while we're providing distance learning activities to children and families?
This is Erica Otieno. I can take that question. So I mentioned in my presentation that we're working diligently with West Ed to come up with how the DRDP will be completed. The question is, will DRDP be required for this fiscal year? The answer is yes, it will be required, but it will look a little different from what has been in the past. We're looking more into using the essential, the one that has the 25 fewer elements on it, and probably reducing that to 15 or 16 of them, and also provide you with resources how to complete. So you said coming soon. How soon is soon? I can just assure you that we're working diligently on this. I would say probably by the end of the month, early to mid next month, you will definitely get some kind of listserv on the DRDP.
Okay. I know that we're running a little low on time. A few questions were asked about counting the unemployment benefit, so the $600. So I'm going to give that to Virginia. So they were asking about the emergency unemployment benefit included in the family income calculation, and if that's going to be used for determining household income eligibility.
Thanks, Alana. So yes, we're in the position as CDE where we don't have a magic wand for things, and so we're bound by a regulation here that which is Title V, Section 18078. That basically says that yes, any unemployment compensations received by families, which would include the $600 a week from the federal pandemic unemployment compensation, and any other sort of unemployment needs to be treated as countable income. So we know this is different from what the federal government is doing around Head Start, but as I said, we don't have a magic wand to fix this, and this would require state law to change or an executive order to be modified. I will add, just as a piece of this, we've also gotten questions about the stimulus check, and that's not considered the same way. So the stimulus check is of the $1,200. That is considered to be a tax credit, so not counted as income for the purposes of determining income eligibility.
All right, so I think that's the last question that we're going to be able to take right now. The team has captured these questions, and we'll incorporate them into our FAQs. As you all saw, this first webinar in this series was pretty heavy on content, given it was the first one. We do anticipate future webinars will have a little less content as we continue to release guidance, and there's less catching up to do, so to speak, and we'll have more time for questions and answers. On behalf of the team at CDE, who are continuously working to give you the best information in a time when information is rapidly changing, we thank you for taking the time out of your day to listen to this morning's webinar, and we hope you'll join us for the next one. Take care and be kind.
Thank you.